Hello and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Now, vaccines. It's almost time where the younger lot in the country that's above and below 65 actually, who got into vaccination in the second round, well, they are almost nearing their second dose. And while we're looking at those numbers, our vaccination numbers, not as impressive really as it needs to be. In middle of all of this, in middle of we reporting news about Covaxin having a shortage, not having enough to vaccinate the country just yet. How are we going to make all the cover in for all these numbers? There has this new concept that has come in, which is mix and match of vaccines. Now, we've discussed this in the past on FYI as well, where we told you which countries were mixing and matching, what were the concerns at that point. And in India, we had told you then that the ICMR was considering this. And now, after doing their due diligence, they have come up with a report. And today on the program, we will talk about that report. What happened when ICMR mixed Covaxin and Covishield, and the results, are they encouraging enough for the same to be done in India? So without any further ado, let's get into our explainer. First up, 4 things that we really need to know about the mixing and matching of vaccines. Now, this is not new. Remember that it started with the HIV research. So not just with the COVID-19, but earlier in similar treatments as well, the mix and match has been done successfully in certain cases as well. Mixing of doses can actually help avoid immunity against a vaccine. Now, remember, we looked at Delta plus variant of the virus. We also talked about how vaccines are built on a particular variant, and if the variant changes, what about the immune cover? Will the efficacy change, etc.? So mixing and matching is basically to give you a cocktail so that you have better immunity against the virus and the future variants that might come in as well. Number 3, mixing vaccines can actually elicit a stronger or longer lasting response. We talked about that in the last episode as well, when we told you that while the mixing of vaccine gives you higher immunity, it also gives you higher side effects. That's something that we need to be watchful about. And number 4, mix and match could actually help us fight the variants, like I have said already. So what exactly has been done in the country so far? Now, we looked at how all the countries and the reports have come in from each of these countries. NIV Pune did a study where they mixed Covishield and Covaxin. Remember, one is adenovirus, the other one is a deactivated virus completely, that is Covaxin, and they mixed it and they saw better results again in immunity. In Spain, what did they do? They mixed Pfizer dose about 8 to 12 weeks after Astrazeneca. So they ended up mixing actually an adenovirus, which is again Astrazeneca, with an mRNA vaccine. And again, the result that they saw was immune response became stronger. That means better immunity. In Germany, what did they do? They mixed doses that led to stronger immune response over there as well. And in UK as well, the trial that was done of mixing and matching of vaccines, in fact, it was given out also to a certain set of people in an age group over there, and they saw good immune response irrespective of order in which the vaccines were given. And this was again done with Astrazeneca followed by an mRNA. In that case, it was Moderna and Novax, etc. So all of these things actually tell you at this point that countries have experimented this, it has worked for them. But if you see the pattern over there, they used AstraZeneca and then they mixed it with mRNA. In India, that's not a possibility as of this moment. In India, we've only managed to mix our Covaxin and Covishield, and thus the questions that arrive over here. The questions that come in at this point is that trials have been too small to test effective combinations just yet. They've been done on too few people to actually have an effective sort of report out. Even the ICMR report, remember, is not peer reviewed. They're still waiting to have others sort of do an analysis and for us to get a clear picture on things. Also, large-scale efficacy studies are becoming difficult at this point, and 2 different vaccines, like we said, the concerns again remain on who will be able to take that amount of side effects as well. Like I said, higher antibodies but higher side effects as well. Also, the concerns are that the studies have picked up 2 picked up rare events such as clotting. They are not being able to pick up those rare events as well, which is a matter of huge concern. Now, but apart from that, this is already a worldwide phenomena, and let's now quickly recap what all countries are actually using this cocktail of vaccines, and they're obviously doing it in different age groups. Bahrain is doing it, Canada is doing it, China is doing it, Finland, France, Norway, Russia, South Korea, Spain, Sweden, UAE, UK, USA. All these countries are already using a cocktail of vaccines. So is this something that India can consider? Is this our way out of fighting out the vaccine shortage? Officially not a shortage, but we are seeing that already on so many people, especially in rural India, returning back saying the queues are too long, or the center is shut, or they've exhausted their vaccines. This seems to be a regular affair now. To talk to us about this, we've got Dr. Chand Wattal with us. He joins us from the Sir Gangaram Hospital. He is chairman of the Institute of Clinical Microbiology and Immunology. We have Dr. Deepti with us. She is a senior lecturer at Queen Mary Institute, University of London. We have Dr. Sapan with us. He joins us. He's a member of the Gujarat Task Force of COVID. And we also have Dr. Trupti with us, infectious disease physician at the Ali Khan Hospital in Mumbai. Let me first go to Dr. Chand at this point. Dr. Chand Wattal, your first thoughts on what we have known about the ICMR report. Like I said, it's not peer reviewed, but is this something that can be considered in the future?
Thank you, NDTV, for getting me here, and namaskar. Yes, the reports, most of the COVID related articles are coming in MedRex or in the pre-reviewed journals that are not peer reviewed. Having said that, and as a disclaimer from the investigators as it is, you yourself said while you were introducing the topic that the numbers of these subjects were around 40 or so, which probably is not a very big number. But having said that, the science of the mix and match is perfectly fine, which we all know on theoretical basis.
Right.
But there are a few things for COVID that we need to understand right away. Number one, this is the first time that a vaccine has been produced in the shortest possible time. And these are all vaccines that are for emergency use. And once you have said that, you can't lose the sight of whatever knowledge is limited in this area. But the science of it, as we know, when you mix and match, you provide more antigens, the responses are much better. That is expected response. But the issue is in the background of either the shortage of vaccines or the vaccine hesitancy or the kind of reactions that we may anticipate is an issue which needs to be addressed before we breed more vaccine hesitancy, because those are the down vaccine hesitancy.
Or no data enough to tell you about how much of clotting can actually be caused. Is that a concern for you?
Yes, it is a concern, but at least there is something that has come in public domain.
Right.
Where even if there are 40 subjects that have been actually studied by serendipity actually, and not as a planned study, and the findings have been interesting, and we can take a lead from the other nations where it is happening.
I see.
And at the same time, we need to understand, we are talking about mix and match of vaccines, but first of all, do we have enough vaccines to reach that numbers that we are talking about mix and match and produce a better response?
Right. Talking about how other countries you were talking about, let me go to Professor Deepti at this point. Professor Deepti, our analysis and the research that we did for the show actually told us a lot of countries actually talked about mixing of the mRNA. The tech has to be the same, right? They were talking about how that can be mixed, and then AstraZeneca generally along with any other mRNA vaccine. In India, the issue is a little peculiar. Right, we have Covaxin and Covishield, not mRNA at all over here. So, how are you looking at it, and what are the concerns for you?
I can't hear you.
Oh, you can't hear me. Okay, let me take that question to Dr. Pandya, if I can. And we'll just fix that audio with Dr. Deepti in just a bit. Dr. Pandya.
Can I have the question again, please?
The concern so far, the norm that we've seen internationally has been mixing Astrazeneca with an mRNA. So India is in a peculiar situation because we are mixing two different techs altogether. How does that play out?
Well,
All right, we seem to be having some trouble over there.
Vaccine, you have to know, have great antibody responses.
Sorry, could you say that again, sir? We lost your audio there. Okay, let's check that on Dr. Pandya, and let me see if I'm lucky enough to have Dr. Tripti with me, at least, who can hear me and we can hear her properly. Dr. Tripti, can you hear me?
Yes, I can.
Okay, brilliant. Okay, so why don't you take that question and answer our queries on how India is in a bit of a peculiar situation when it comes to the cocktail of vaccines.
So first of all, mix and match is a proof of concept, which wasn't designed to be that way. It was just serendipitously found out that mix and match vaccines can work. What is important to understand is that when we study these small populations who've received two different vaccines, what we measure is probably the antibody or the T cell response, which is an in-lab measurement. We still do not know how does that turn out in real life efficacy.
I see.
Does it really prevent infections? Does it really prevent severe infections and hospitalization? And to understand that, we definitely require larger trials, because it's only when you vaccinate a lot of people with two different doses and we actually wait for them to get COVID, will we actually be able to see whether there is a real life efficacy. So as a proof of concept, it does work because the antibody levels with mixing were better, in that little small study of 18 patients that they've done. But it's definitely encouraging, especially in light of very similar results from across other countries.
Okay, very fascinating on how this is only to give you a number on antibodies, the response to further infection, etc., and how much of a efficacy does it actually provide is not known. Very fascinating over there. Okay, let me try Dr. Deepti. Dr. Deepti, you can hear me now?
Yes,
Professor.
I
can. Okay, great. So your thoughts then on, is this a journey you think India can go on? What I'm understanding from all of you and what we got from our research also is that this is not an ideal situation to start with, but this is coming from a place of necessity. The fact that Astrazeneca could not provide as many doses, that was a need, that was a genesis of actually people trying to even experiment with mix and match of vaccines. Are we saying this is only to be done in the most desperate situations when you know that a wave is coming and you need to put more and more people under the immunity cover and should be avoided otherwise?
No, I don't think so. I mean, many countries have looked at mix and match, and there are large trials now that have been done with other vaccines like Astrazeneca and Pfizer, which have actually shown a boosted response compared to, for example, AstraZeneca plus AstraZeneca. AstraZeneca is the same as Covishield. So it's important to do these studies, and I don't think you need to be in a desperate situation to consider mixing and matching. I think providing more flexibility to the program is sufficient. Having said that, I think you need proper trials to actually look at mix and match. And this study of 18 people who accidentally received Covaxin after Covishield, rather than a trial where you actually look at one regimen compared to another, I think is insufficient to tell us very much about this. Because if you want to talk about safety and efficacy, you need larger numbers, and ideally this should be a randomized situation where you give people one regimen and compare to the other regimen. Even the group studied here, the 18 people compared to 40 other people, were different in many respects. I mean, they were different in terms of the duration of interval of vaccine between them, in terms of age groups, and they may have other differences as well, because if people were accidentally given one vaccine instead of another one, there might be other features that differentiate these people that might explain some of the different responses. While it's heartening to see that in these 18, the responses in the heterologous or the different vaccines were increased and it was safe in 18 people, I do think we need larger studies to assess this.
Well, in India, it's hard enough for people to get them to the vaccination center. So I don't know how exactly this entire template of getting volunteers to try out cocktail of vaccines is going to work out. Let me take that to Dr. Chand as well. Dr. Chand, your thoughts on how this is not entirely necessity, but do you think India has an infrastructure that will be capable of even producing a study like this in the near future?
No, when you talk of infrastructure for our country, we have ample times shown that infrastructure is not lacking. But our issue is that we have a huge population. You cannot compare our kind of people and the vaccination drive to any other country. Every state is one full county or just one country that we are comparing ourselves with. So we have a humongous task in front of us, where we are primarily stuck with vaccinating each and everybody above the age of 18. We are not talking of at all below the age of 18. Here we are trying to vaccinate people with the aim that at least they will have a mild illness, or even if they get admitted, they will not die. We are not talking of they not becoming spreaders or they not getting infection.
I see.
Because we have seen that vaccinated people also will get infection. They can also be spreaders still.
Of course.
But what we have been able to show with the vaccination is that people will not probably die. They may have a mild illness. But here you are talking of mix and match. Is a different kind of a scenario. Probably we haven't reached that stage. Let us reach that stage and have more studies in the meantime, so that we know the kind of vaccines we have. That's our own vaccine. That's the Covaxin, though Covishield is partly ours. It could be an interesting area to see in the meantime and gather data in our population as to how it will work out in due course of time.
Okay. Dr. Tripti, if I can come back to you at this point. So, we are at a very interesting time in our vaccine journey in the country. We have something like the Astrazeneca, which is like a patch vaccine, a DNA vaccine that is out there. Very fascinating tech. It's needle free. You can just put it like a band-aid and then it dissolves. Then we've got other vaccines. J&J just got approval. So, I'm just really fascinated by the tech on which these vaccines work. And I'm trying to see, does the cocktail work between all technologies, or are there specific techs that actually gel and work better together?
That's an excellent question, and I think that's one of the things that we really want to see by doing larger clinical studies that mix different kind of vaccines and have a head-on-head trial just like Dr. Dipti described. What is important to understand is when we use vaccines from different technologies, they each work differently. They come in with a different mechanism of inciting an immune response and a different group of side effects. So, for example, when they studied the immune response in vaccinees who received Pfizer vaccine after Astrazeneca, what they found was the Astrazeneca vaccine incites a much better T-cell response, which is a kind of response that we don't usually measure. And the mRNA vaccines incite a very good antibody response. So that is the interesting area which we need to see, do different kinds of vaccines coming together actually potentiate the immune response that will actually be seen after the end of those 2 doses.
Interesting that bit. Let me try and see if we've got Dr. Sapan back with us. You can hear me, sir?
Yes.
Okay, great. So
yes,
just take us through this entire thing on, because the only fascinating bit that remains, or the concern at this point that remains, is the reactions that come with making a cocktail out of vaccines, from clotting to the others that we pointed out. How dangerous can it get, or do you think there are specific age groups that should be kept out of the realm of cocktails of vaccine?
So I think that is something that we still have to see, because there is not enough data on the side effects of these cocktail regimes, the mix and match. Especially if you look at the ICMR the study which was done, we still have only about 60-70 days of follow-up. And in some of the complications which are long-standing, you will still need more time to look at that. Whereas the clotting disorders after the
Okay, really bad line with Dr. Sapan over there. Dr. Dipti wanted to, Tripti wanted to finish that, please. Please go ahead.
So it's actually interesting to know that the Astrazeneca vaccine trial, which was mixed with Pfizer, it was done because a few countries in Europe banned AstraZeneca for a period because there were increased clotting events with AstraZeneca.
Yeah.
So it was actually to combat what they thought would be a side effect, a rare side effect of AstraZeneca. So in fact, mixing vaccines, yes, we definitely need to do larger trials to see if they are safe. But mixing vaccines will actually be the answer to reducing side effects by a single vaccine.
Fascinating. That's a bit of a paradox over there, no? Professor Deepti, if you want to comment on that point?
I mean, I agree with that entirely. I mean, you know, a lot of people who, young people who were initially offered AstraZeneca are now being offered Pfizer as a second dose because mix and match is found to be safe. And we know that mRNA vaccines, which is the Pfizer one, are not associated with those sort of clotting side effects. And we know that they boost immunity much more. So we know that AstraZeneca plus Pfizer is a much better combination than AstraZeneca plus AstraZeneca. So in all respects, mixing and matching has been found out to be better. And are there side effects? So there is an increased risk of local reactions. So just things like local pain or fever for 1 or 2 days. But they're all mild side effects, and there have been no severe side effects noted because of mixing and matching, but definitely better immune responses and not having to deal with the clotting side effects of AstraZeneca in younger people.
Okay, good to know that. And there's also, you know, I remember interviewing people from Sputnik, and the CEO there had actually said that they're actually working with AstraZeneca to improve their immunity, and then they were working with Johnson & Johnson as well. So they're already working on a tech that gives you a vaccine which is part of the combination, and there are other vaccines as well. Sputnik, for example, which is 2 different vaccines that they give you in the first and second one. We'll talk about that on the other side of this very short break. Welcome back. We're talking about the ICMR report, which talks about mixing and matching, which is Covaxin and Covishield. We discussed that at length, but I want to go back to Dr. Tripti at this point and talk about Sputnik, which already is 2 different techs put in the 2 different doses. How does that work then?
So it's actually not 2 different technologies. They just use 2 different vectors. So it's still an adenovirus-based vaccine. But instead of having the same genetic vector for both the doses, they have 2 different vectors. The idea being that by using 2 different kinds of vectors, they might be able to increase the insertion of the vaccine into the cell, and also probably combat the side effects. For example, if I receive an adenovirus vaccine today, there might be certain antibodies formed to that adenovirus. So the next time when I inject a new adenovirus, those antibodies will not act against the vaccine that's coming in. So that was the premise on which they just used 2 different vectors, but the technology is still the same.
All right, very fascinating there. Lots to take away from all this conversation. Thank you all for your time. That's all we could pack in today's episode of FYI. See you again tomorrow. Bye-bye.